59 years ago, President Lyndon Johnson declared February American Heart Month. The awareness campaign has been observed every year since, yet we still need reminders from time to time on how to pay attention to heart health. So this morning we have asked SouthCoast Cardiologist Dr. Roy Flood to join us with some heart-healthy tips and maybe some insight on individuals who are more prone to heart disease and heart attack. Good morning, Doctor. How are you?
Good morning. Thanks for having me.
Thank you for being here. And again, this is a time that comes around that everybody really pays a little bit more attention to, something that maybe we don't pay enough attention to the rest of the time of the year.
Well, it's always a good time to think about your heart health, but especially now we've come off of a great holiday season, maybe slipped a little bit on our dietary habits, so now's the time to get back in gear. February is a good time to think about your blood pressure, your cholesterol, your exercise program, and if you're doing the right things, fantastic, but if you have some room for improvement, now's the time.
Do you recommend people do that sort of stuff at least once a year?
At least.
Right.
At least.
And February is a good time.
February is a good time, and I like to make sure that it gets in before the holidays too, just to kind of do a reminder.
Right. I know there's no heart condition is the same, or no person's heart condition is the same, but are there some general things that everybody can do to kind of work ahead?
Yeah, I think that education and awareness of your own issues is really the key thing. And I mentioned a few minutes ago, blood pressure. People need to know what their blood pressure is. You need to know what family history you may have. You need to maintain an exercise program. If you're smoking, you need to stop. So those are things that can help us keep your heart healthy.
Yeah, we see here on the test, cardiac calcium score test. How can people go about doing that, and what does that do for folks?
Well, that's an excellent screen to give us an idea as to whether or not you are at risk for blockages in the heart arteries, or, quote, hardening of the heart arteries. And it's a CT scan without contrast. It's a very simple test, and it gives us a lot of information, and it can identify whether or not you are at risk and whether more testing is needed, et cetera.
Right. And then some warning signs for everybody, other than family history, which is probably the biggest indicator, isn't it?
It's a huge indicator. Huge indicator. But other things you can do are, maintain your exercise. Yeah. Get your exercise program going. Watch what you're eating. Count your calories. And listen to warning signs. If you're having difficulty with breathing, if you're having unusual indigestion type feelings, if you're dizzy and feel your heart racing, these can be signs that there's an underlying problem that we need to address.
Right, and of course, not just family history, but demographic groups are affected differently as well.
Sure, and we are in a time of the year where we are especially cognizant of our African American population. We have a much higher incidence of heart disease in general, but in particular, hypertension, coronary artery disease, diabetes, and obesity. So these are all things that affect our whole community, but we're particularly concerned about our African American community this time of year.
Yeah, I think some of the information you provided us is 30% more likely to be affected by heart disease.
Yes, and that parlays into more hospitalizations, more heart attacks, unfortunately more cardiac-related deaths. It's a huge health problem, and we want to nip it in the bud, so to speak.
Right. The warning signs, the ones that we always used to hear: shortness of breath, maybe a pain in one arm. If it's gotten that far, you've probably let it go too far, haven't you? You want to see some of the other ones that you were talking about.
Yeah, we want to see you before those things actually start to happen. I'd much prefer to do an evaluation when we're just kind of learning what the risks are, what sort of lifestyles you lead, and try to affect things on the front end. Once you're having symptoms, once you're getting that burning in the chest or exertional sweatiness, dizziness, and chest discomfort, then we have an active problem that we need to go after quickly.
And at that point, it's not your family physician that you contact. If it's that serious, you go to the emergency room.
Go to the emergency room. Get help however you can get it, as quickly as you can get it. But in those situations, being in the doctor's office is not as useful as it would be prior to the onset of symptoms. Then we need things that can be done urgently in the hospital.
All right. Well, if somebody has not checked on their heart in quite a long time and they are now inspired to do so, what should they do?
Give us a call. Let's try to get you in and do an assessment.
Okay, and you're at SouthCoast here in Savannah?
SouthCoast.
Fantastic. Doc, thank you so much for coming in. I know it's an important time of year, a busy time of year for you as well, so thank you for taking the time.
Always a pleasure. Thank you.
Appreciate it.